A nurse without an N95 mask raced in to treat a code blue patient. She died 14 days later. There's a nurse in Los Angeles, did not have the proper mask, was treating a COVID patient, and she is no longer with us. Here's what the Los Angeles Times has to say. The decision that Celia Marcos made, the one that would ultimately steal years from her life, had been hardwired after decades of working as a nurse. On the ward that she oversaw at Hollywood Presbyterian Medical Center, a man with COVID-19 had stopped breathing. Marcos' face was covered only with a thin surgical mask, and obtaining a more protective N95 mask before entering his room would have wasted valuable time, her colleagues say. 61-year-old charge nurse knew the chest compressions and other breathing treatments the patient needed would likely spew dangerous virus particles into the air that could land on her face and clothing. She would be at high risk for catching COVID-19, but she raced into the room anyway. 14 days later, she died. Marcos died in the same hospital where she had worked for more than 16 years. One of at least 36 healthcare workers in California who have succumbed to COVID-19. Now, the staff at Hollywood Presbyterian say the reality of all this is much bleaker. As a charge nurse, Marcos was required to respond to patients who stopped breathing, but she wasn't provided an N95 mask at the beginning of her shift. The masks are scarce, and staff who do get them are often asked to reuse them over multiple days. The hospital wasn't giving us the appropriate equipment. The N95s were locked, said one nurse who, like others, spoke on the condition of anonymity. Why were they speaking on the condition of anonymity? Well, as the Los Angeles Times tells us, they're fearful of retaliation from hospital administrators. Because what they're doing is they're telling the truth that they weren't giving adequate equipment. They weren't given an N95 mask. This isn't just, oh, this woman rushed in to save a guy's life, didn't have her mask with her. What a tragedy. This is a tragedy. She wasn't provided the proper equipment. Though all frontline workers are vulnerable to the coronavirus, Marcos' death illustrates the way that risk has been amplified by a national shortage of personal protective equipment. Such exposures have been cataloged at hospitals across California. Remember when Gavin Newsom was getting all that praise because he was sending ventilators and other equipment all across the country? Remember that? Remember when he was getting all the praise for sending equipment all across the country while he was neglecting to send some of it over to Riverside? Because that wasn't as nifty as a photo op for him. And don't get me wrong, I'm not saying it's bad that he's sending stuff all around. That's not a bad thing, of course. I want every hospital to have all the equipment they need all over the country, all over the world. But don't you think when you're the governor of somewhere, you should make sure that all the hospitals in your state have everything they need first? Don't you think it's a little ridiculous that we start praising these governors for basically just doing their job and they're talking somewhat competently? So we anoint them. We want them to be president. Meanwhile, by the way, Gavin Newsom simultaneously opening up the permits for 25 fracking wells, neglecting Riverside. And guess what? There weren't N95 masks everywhere there should have been either. Remember when President Newsom was trending on Twitter because of what he was doing all over the country? Meanwhile, nurses right in Los Angeles don't have the masks that they need. Is this going to get reported everywhere? Is this going to be all over the national news? Are the same people who got hashtag President Newsom trending, are they going to criticize him for this? Probably not. Probably not. Fifth largest GDP in the world, California. And in Los Angeles, nurses don't have the proper masks that they need. I mean, it's really sad. It is just really sad. Lying in her hospital bed, surrounded by colleagues who had become her caretakers, One of the last things Marco said was, "I don't want to die." Richest country in the world, state that has the 5th highest GDP. Governor was recently applauded, and people were saying he should run for president because of the equipment he was sending all over the country. Meanwhile, in our own backyard, nurses don't even have the masks that they need, and it's costing them their lives.
Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Yeah, yeah, yeah. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your